is ankle neuroprolotherapy and what is it used for? Ankle neuroprolotherapy is predominantly used for patients who have symptoms of neuropathy, or in other words, symptoms of having had damage to their nerves. It's a very simple procedure, and it essentially involves doing a simple series of very superficial injections over the 5 major nerves of the foot using a substance known as mannitol. Mannitol is a natural sugar. It comes from the flowering ash tree. The risk of allergic reaction is extremely small, next to none. And what you're basically doing is injecting a substance over the nerves, and essentially you're trying to calm down the inflammatory issues that are occurring with the nerves. Inflammatory messengers in the nerves cause a lot of pain and dysfunction, and there seems to be a strong healing potential to the nerves, whereby after a couple treatments, many patients report an increase in sensation, a decrease in pain, an increase in warmth, for example, in their ankles. So it's a very safe and often very effective means to treat ankle neuropathy. What types of neuropathy does this treatment help? It can help most forms of neuropathy. One of the most common forms we see is diabetic neuropathy, which can either affect the nerve fibers themselves, it can affect the insulation around the nerves, or both. Different kinds of neuropathy work slightly differently. We found that in general, patients who have a predominant issue of pain, more so than numbness or tingling, tend to respond slightly better than those who simply have numbness. But we have found that different sources or different causes for neuropathy can respond very well to ankle neuroprolotherapy. Are there any contraindications? Generally, no. There are a few big ones. If someone, for example, has an active infection under the skin, like cellulitis, as we call it, if they have a history of cancer and there's a possibility that the area we're injecting might be affected, we would discontinue that. If they've had a recent surgery in that area, we may hold off. One thing that can be difficult is patients who have a great deal of swelling in their feet. Some people have what they call edema from excess fluid there. And what we'll try to do in that case is try to limit the amount of fluid by telling the patient to take your diuretic or your water pill early when you come to do the treatment. Probably keep your legs elevated, perhaps come early in the morning. Beyond that, there are very few contraindications. Is ankle neuroprolotherapy painful? That's a good question, and people often ask that. You always have to keep in mind that pain is very, very subjective, and what is painful for one person is not painful at all for another person. In general, most patients, myself included, who've had a version of this done, report a little discomfort. What we'll typically do is we use a very thin, small needle, typically a 27 gauge needle, which is, if you know anything about needles, the higher the number, the thinner the needle, and we'll use a cold spray along with them as well to help numb up the skin. Patients will sometimes feel a mild burning sensation during the injection, and that quickly goes away. As a general rule, I would say about 95 to 98% of patients tolerate these injections very well. What is the overall success rate we've seen with ankle neuroprolotherapy? It would be estimated in the range of about 70 to 75% of patients report good or significant relief with ankle neuroprolotherapy. Once they've achieved the designated number of injections, we will look at what their relative pain scores are after the treatment as well, and compare them to what their relative pain scores were before the treatment. The other thing we will do is that we will measure their sensation scoring both before and after treatment and see if there have been any changes involved. But I can pretty comfortably say that the majority of people who have this done, when you ask them at the end of it, are you happy you did it? The majority will say, yes, I am.